Medicines can have the opposite effect of what they're meant to do if you take too many at one time or during the day. Instead of helping you, they become quite dangerous. Dr. Danish Ali with Archpoint Pain Institute joins us to talk about polypharmacy and its dangers. Dr. Ali, there are many people that you may go to their homes and see their medicine cabinets or their desk, and they have tons and tons of medicine and pills that they take on a daily basis. And some have questioned, in some instances, some doctors or multiple doctors overprescribing for a person. Is there such a thing where you can have too many medications that you simply don't need?
For sure, Isaiah. And we see that very routinely now in the medical practices. And what's happening is that folks are ending up in multiple different specialists' offices and getting prescribed medications, rightfully, what are needed to help treat whatever conditions they have going on. However, what we're seeing is that an increase in the number of medications that our folks are taking. What happens is that when you have all these medications, Isaiah, they often interact with each other, and there may be what we call synergistic activity, where one medication combined with another medication exacerbates the symptoms that you may experience, or the combination of those two things may be where you get those side effects a little bit sooner. For example, like medications that, for example, people take to help them sleep at nighttime. If you take too many different medications like trazodone, Ambien, and melatonin, then you're going to be too sleepy and be drowsy the next day. Or even some nerve pain medications that you may take along with sleeping medications, and then the nerve pain medications also have side effects of sleepiness. And so the combination of all of that will make you very tired and sleepy the next day. So that's just an example of what we're seeing as it relates to polypharmacy and too many medications being prescribed and having side effects as a result of that.
If you're one of those individuals and you have a long list of medications each month that you must take, can you go to your doctor and say, look, I think this is too much. What can we get rid of? Or
I think it's important to talk to your primary care doctor, Isaiah. Those are the gatekeepers. Yes, you have all the specialists to help treat different things, but it behooves folks to go to their primary care and say, hey, listen, these are the lists of medications, or even bring all your meds in with you. Bring it all out to the table and lay it out there and let the doctor sort through those, because oftentimes some of those medications, I've seen patients be on multiple NSAIDs or anti-inflammatories. They may be on ibuprofen, they're getting meloxicam, and now they're getting Celebrex from another provider. And all three of those are NSAIDs and anti-inflammatories, and if taken together, they may cause GI bleed, stomach upset, all of those things that we are concerned about. So bring all that stuff in and bring it to your specialist as well, because they may not know what meds you're on, or they may say, hey, listen, I have a better alternative that may have less side effects for you.
And we tend to see this a lot in senior citizens, but they are, I don't want to say hooked or addicted to their drugs, but they love taking their pills. It's part of their daily routine. So if you have mom or dad or grandma or granddad, and they're on a long list of pills, how can you convince them that maybe you don't need all of these now? And there are some pills that may run its course, right?
That's exactly right. Some of these medications, especially as we age, our metabolism goes down. We have other body changes that happen. And so sometimes that blood pressure medication that you've been taking for years, you may not need it as much, right? Or you may need a lower dosage. Maybe you've lost weight and now you don't need that blood pressure medication as much because your blood pressure is improved. Same thing for blood sugar medications, diabetes medications, right? What we see is that folks that often lose weight, or their dietary changes they have, or they're walking or exercising more, they may not need as much insulin or anti-glycemic medications that they've been taking. So yes, it's so important for us to talk to our providers, our physicians, and say, listen, these are meds that I've been on. Do I really need to take all these medications, and let that doctor ponder a little bit and say, hey, listen, this may not be something you need to take every day, or maybe you take this after you check your blood sugars.
All right, Dr. Danish Ali, we appreciate the great medical advice. Thank you, sir, and thank you for joining us here on The Factor tonight.
Thank you, Isaiah.